Hello, everybody. Welcome to day 2 of All About That Place. We hope you enjoyed the first day and we're ready to dive in. And today we're finding out all about health and medicine, how that affected our ancestors, then the health and medical care in the places that we're studying. So let's dive straight in with today's task. I'll share my screen and we can chat about that. So today's task is Doctor Who. We're going to perform a case study on one health professional. Choose a specific person, and that can tell us a lot about health and medicine in your time and place of interest. And so we ask you to identify a healthcare professional, whether that's one of your ancestors or somebody that your ancestors would have used when they were not so well. Might have been a doctor, a surgeon, a midwife, a chemist, could be a wet nurse or anybody involved in medical care at all. So, Jude, Liz, is there anybody that springs to your mind that you think you might investigate?
In my one place study of Dunster, I'm very lucky that there was actually a village hospital there that was a sort of Victorian philanthropic establishment set up by a local vicar and the local squire, various other vicars in the area. So it almost became a one place study in itself, actually. I gave a talk about it to the Society for One Place Studies and then a little mini version to All About That Place last year. But I found it absolutely fascinating because until I really started looking at who the patients were, who the doctors were, I didn't really have any idea how my ancestors or the people living in my one place study would have accessed healthcare. And it actually taught me a lot about how healthcare was provided at the time, because the hospital doctors were all local GPs. So I learned about the rota, the payment, the treatments. They've not all the admission registers survived, but enough of them survived to give a really good flavour of the types of operation they were doing. And some of the operations were really major, but it gave me an idea about how things were funded, what you would have had to have done to get healthcare. And also the people at the time could buy vouchers. So if you were well off enough, you could buy, so many inpatient vouchers for X amount, so many outpatient vouchers for X amount. And then whoever needed healthcare would approach somebody with a voucher and say, I need some inpatient treatment or outpatient treatment. And they would then have to present themselves at the hospital on a particular day and receive treatment there. So I found it fascinating. I agree, it's a great way of looking into the healthcare of a place. Whether you research one of your ancestors or whether you research somebody who would have provided healthcare locally, they may even have been in another village. So, but it'll certainly tell you a lot about your ancestors' lives, even if your ancestor wasn't a medical person.
Sounds really interesting.
And I think it can help you really understand why an ancestor lives in a certain place. I have my paternal great-grandfather who was an attendant in an asylum, but he'd been a farmer about 50 miles away and in a hamlet where all of that Rhodes family had been for centuries. So he suddenly left farming, moved a distance, and became an attendant in an asylum. So for me, it's the interest is in why turn to a medical role, why move, which came first? Did the move come first and then the employment, or did a job opportunity come up to get away from farming and that took him to the place where the asylum was? So I think there's a lot there that we can pick into. And certainly with asylum records, there's records of the staff. But I think another interesting thing is, I found out my great-grandfather was an asylum attendant through the census records, as we often do about occupations. But I think when people are looking through the census and they'll say, oh, nurse, my ancestor was a nurse. That is such a broad thing in the 1800s. you know, and like you said, Ruth, you know, it could be a wet nurse, it could be a laying out nurse in the community. It means so many things. And somebody in the workhouse can say that they're a nurse, but actually they're an inmate in that workhouse and being asked to help out as a nurse. So it's a vast subject that people can really delve into.
It really is. And I know there are lots of records about healthcare professionals. I was lucky enough with the University of Strathclyde to visit the Royal College of Physicians and Surgeons archives in Glasgow. And they've got so much information about anybody that trained there. And I think particularly about Scotland, but about the careers of the medical professionals. So yeah, there really is a lot that you can learn about them.
Absolutely, Ruth. I visited the Royal College of Nursing archives, the RCN, which is also in Scotland. It's in Edinburgh, and I know that the museum and the centre is in London, but the actual archives are in Edinburgh, and fascinating.
Just going back to what you were saying about finding out about people's occupation through the census. I did a short house history for my sister who lived in a house built in the early 1900s in Epsom. And it was one of a terrace. And initially, all the people who lived in the house and that terrace were building trade kind of people. And the terrace was built around the same time that the Epsom asylum complex was built. There's about 8 asylums that were built for the London Metropolis organisation. I can't remember what they were called at the time, but they built all these asylums. And so at the time, initially, you've got all the tradesmen, but then 10 years later on the census and following it through on the electoral rolls as well, it changes, and they're all medical, they're asylum attendants, and there's doctors living on that same terrace. And so the coming of those asylums changed that area. And yeah, it's all very, very interesting.
I think it's great to be able to put your ancestors or the people in the place you're studying in context when it comes to medical things. And it might be, you know, as you were saying there, the building of an asylum changed occupations, but also perhaps, you know, in World War One, maybe one of your ancestors volunteered in one of the VAD hospitals. Yeah, I've just been looking at those for my one place study on the Red Cross website, and it's really interesting to see who volunteered. And perhaps, you know, not everybody was a nurse. Some of them was a superintendent, and somebody else was a doctor. I found a couple of people who were cooks, and they're all listed on there, and that gives you a little sort of insight about the structure of the hospital, how many people perhaps would have worked there at any one time. And the Red Cross website will also give you the number of hours they worked as well, and any other hospitals that they might have worked in. So,
Wow.
you know, even if you don't think you've got any medical connections in your place, you may have it, but just not have realised it yet.
Absolutely, yeah. So having picked your person, step 2 is, what are you going to examine about their working life? I think we've given you plenty of ideas for things that you could look at. And then we have a second task around doctors. Just write up some notes about what have you learned about health and medicine in your area of interest. And your area there is as wide as you want to take it, whether it's one person, one institution, but healthcare in a particular place. So, and just a reminder that we are looking here at a draft version of the workbook. And so if it has changed by the time you see it, that's why. Thank you. I think we've given people plenty of food for thought on health and medicine today, and some very exciting talks coming up, including, I think, today one from you, Jude, on, well, we won't repeat the name that we've been giving the talk.
Well, absolutely. It's unsanitary.
Yes. So have a great day, everyone. Thank you very much. Bye-bye.
Bye.
Bye.